All right. So for the next deformity which we'll get to talk about is what is known as a pigeon breast deformity. Okay, pigeon breast deformity. So we have it here. All right, you can see it's the pigeon breast. Okay, so it's actually a common name for what? Pectus carinatum, which is a chest wall deformity. Okay, so it's an abnormality where the sternum and the adjacent ribs, they protrude outward. Okay, they protrude outward. So it's a congenital deformity, meaning the person is actually born with it. So the anterior chest wall, there's outward protrusion of the sternum. Okay, so other names, this same thing can be called pectus carinatum, pigeon chest, you know. So the chest looks what? Pointed or ridge-like. See? Sometimes it's symmetrical, happening on both sides. Okay, while sometimes it's just on one side. So causes can be congenital, meaning the person is just born with it. Sometimes it's associated with some genetic issues, okay, linked with syndromes like the Marfan syndrome, the Mokoil syndrome, and the Down syndrome. Then sometimes it's as a complication of surgeries, okay. Then sometimes it's pubertal growth, sprouts, okay. So symptoms, there's visible protrusion of the chest walls. Sometimes there's shortness of breath. Okay, there's complications in the respiratory system. Sometimes there's chest pains. So the psychological view, you won't actually like the way your body is looking. There's social anxiety and there's low self-esteem. Okay. So diagnosis is clinical examination. You can clearly see it. Okay. Then you can actually want to do X-rays to see what is inside. Then pulmonary function test. Treatment, you can use braces, okay, in children and adolescents. Okay. Surgeries reserved for severe or resistant cases. Then there is a surgery which is known as the ravish procedure, which we'll get to talk about it later. Okay. Then you can also do physical therapies, psychological support for body images, so that the person will actually get to love their self the way they are.